You made it to the Go Commando Show with Fred Galvin. On our new mission, we contend with the naked truths of health, leadership, and overcoming adversity. Now it's time to go commando.
In the treatment of my neck over the years, I have had a lot of medical doctors talk to me about the high risk of chiropractic in especially an adjustment to the neck that they've told me, could a piece of bone could become lodged in the spinal cord. What type of training do you receive at a chiropractic school, especially being very sensitive around the neck?
We go through a lot of training on exactly how to treat people's necks, and also perfecting technique, and then knowing like what to look for, when to adjust, when not to adjust, when to use instruments, when to refer out, is highly taught and just so highly taught and trained so that we're ready for everything. And where if there's any risk at all, then I'll use instruments or and that's why we have that's why I have an X-ray machine to check, make sure that everything seems okay for any type of adjustment, and then also have people that refer if we need to do MRI, but very, very safe, very careful.
Yes. When you say you refer out, what type of conditions do you refer patients out to other doctors?
It's I'll refer out for say if depending on say rotator cuff or a knee injury like ACL, some hips, different things to which it depends on there's some things I can't help out with, so I have no problem telling people that and saying, hey, I think you need to go see an orthopedic surgeon, or go see this doc, go get an MRI just to make sure that something's not completely torn, or there's a lot of different things that can cause for concern.
Now, what exactly are you working on with the laser to the
Right now,
neck
I'm running the laser over your neck because you do have a history of bulging discs in your neck. This will help repair the tissue in the disc, and then also get rid of the inflammation so that neck can feel better and repair itself quicker.
Good. And the adjustment that you just did on my neck, could you speak to that a little bit?
So with your neck, you had basically multiple vertebrae that were twisted backwards to the right, and so what I did was just press them back forward so that all the vertebrae were perfectly in line, so that way it doesn't pinch any nerves, takes less pressure off the disc, and also it'll help out with his rotation in his neck, have better movement, and even having all your vertebrae in line, and if the curvature is correct, then it'll reduce the chance of getting arthritis at a much quicker rate. And that's something that a lot of people don't realize is arthritis isn't just because you get old. Arthritis is bones that have sat out of place too long on top of one another for an extended period of time. So it just basically wore out.
So when a patient comes in and they get an adjustment from you, say in this case the neck, and then they go back home and they watch a computer, or they're staring down, or they're laying in bed to where it's their neck is bent in the wrong direction, but they're coming back to get treated from you. How long, how many sessions is the typical to make sure that their neck holds that adjustment that you're giving them?
I have a lot of people that they just come back in maybe once I get them better, and I've had serious neck injuries, whether it be from car wrecks or from different things, to where after they're all better, they may come in once a month, once every 6 weeks or so, because just with life and everything, we do put some daily wear and tear on our bodies, and it's good to just make sure that everything's aligned. And I notice that my patients are they get a lot better at noticing when stuff is out of place, when something's just slightly off, and once they're all the way better. And so they're pretty good about judging for themselves that they need to get back in.
Can you explain a little bit about how insurance has changed over the years, where now more insurance companies are covering chiropractic, or are there some cases where that's becoming the opposite, where they're not covering chiropractic?
It's getting better and better over the years, depending on insurance, of course, and everything. But there's some that are even noticing like success rates with, say, like bulging discs and radiating pain down the legs. Like with chiropractic, it's very good. And, so it's becoming more and more common that they rather pay for a chiropractor to do these treatments than to have really expensive surgery bill. And so it's pushed for more and more for patients to try something like this that's less invasive before taking that other step.
Yes.
How's that? Pretty good?
Feels good.
Good.
To all my fellow grunts out there who in your youth felt it was your duty to protect us, I salute you. And thanks to the listeners of the Go Commando Show who labor on the farm, who are sweating on the construction site, putting forth your very best at the office, you are making a difference. Support the Go Commando Show in our pursuit of bringing you the highest quality professionals. Infiltrate the website at gocommandoshow.com, where you can view all of the podcasts and arm your team with incredible deals on health supplements, commando clothing, and equipment. Every time that you get a good deal, it supports the show. What deals? When you purchase anything from the website, Amazon, healthcare supplements, you're covering our six. And to the ladies on the team, when you outfit yourself in the super sexy threads from Naked Zebra, and yes, I'm talking about in a fuego, you are firing the sniper shot for our commandos. How else can you support? It's simple. You smash the follow and subscribe buttons on our social media. That is how you support us bringing great guests to talk about serious subjects, not the mainstream media's fake news. So thank you, and until our next show, stay in the attack and go Commando.